Since the decision has come down, and frankly, even before the decision came down, we have been scenario planning behind the scenes and being prepared for any of the outcomes. In the last few weeks, we've really been reflecting on the real people that are going to be impacted by this ban, and this understanding that for Iowans, that the impact of this is not only going to be widespread, but it's also going to be generational. And in a space where we already know that there are so many health inequities in Iowa that are a challenge, from maternal mortality, where Black Iowans are 6 times more likely to die from a pregnancy-related cause. We know that bans like this only serve to further increase those types of disparities. So in the last few weeks, we've really been focused on the real people and the patients that are going to be impacted by this, and ensuring that we are standing by, ready to help patients receive access to care, even if that means traveling out of state.
Can you elaborate as to the resources that you, I guess, are allocating to Iowa, and how women in Iowa will access abortion care going forward after the injunction is dissolved?
Sure, I can talk a little bit about the regional planning that we have been doing as an affiliate, recognizing that we wanted to be prepared for any scenario. That has included investments in border communities like our Mankato Health Center in Minnesota. We expanded our service line to include medication abortion services. We are also in the process of expanding the footprint of our Omaha location as well. We have a 9,000 square foot expansion that is underway, and it's going to give us the ability to triple the number of patients that we can see, going from 4 exam rooms to 13. So part of this is about a regional strategy, ensuring that if we have to support patients within traveling, that we're thinking about the spaces that we can see patients that would be traveling from Iowa, and also recognizing we're going to continue to invest and use the resources of our patient navigators. Since the Dobbs decision, when people have reached out in terms of needing help finding access to an abortion appointment, those patient navigators have helped more than 4,000 patients so far since the Dobbs decision. And a significant number of those folks have been from Iowa, even before the decision on Friday. And so that work will definitely continue, and that's going to be an important investment as well.
And then just a follow-up on that, I guess, can you talk about what your clinics in Iowa are experiencing right now? I mean, are they rushing to, get people in and see people? And will Iowans see long wait times after the injunction is dissolved in some of these other states?
So one of the things that we have been focused on from the very beginning in terms of thinking about access within Iowa, and our teams, our providers there, have been just dedicated and committed to ensuring that they're able to see as many patients as possible, for as long as possible, and that commitment has not changed. We also are understanding, with this new landscape that we find ourselves in, where we are constantly navigating restrictions on access to abortion care, we're really taking a regional approach, recognizing that we want to ensure that individuals are able to get to where they can get safe health care. And so a big part of that is the investments that we are making within our various facilities in order to do that, recognizing that we're going to continue to see more people traveling, not only from Iowa, but outside of our region as well. We've experienced a 100% increase in the number of individuals traveling from outside of our region. And so with that, in addition to the investments that we have made within the Mankato location and within Omaha as well, we're taking that strategy to our other health centers to ensure that we can expand access. For example, at our St. Paul location in Minnesota, we have expanded the number of abortion appointments there, both for medication abortion and procedural abortion. And in Minneapolis, we had a large expansion there as well, to ensure that we could meet the needs of the ever increasing needs of communities that are being faced with these unjust bans.
I am wondering if you can talk a little bit about the details of the transition from the injunction being lifted. If you guys are expecting to have you changed any services so far, or what is someone seeking these services going to experience if they're looking for help today versus on Friday or whenever the injunction is officially lifted?
So thinking about Iowa specifically, we are going to continue to provide healthcare and compliance with the law when the injunction is lifted. Uh, and that will ensure that we will continue to provide abortion care, and as long as no cardiac activity is detected. So in addition to that, we're also going to continue to provide all of the other services that we provide in Iowa as well. Everything from access to birth control, annual exams, thinking about emergency contraception, HIV prevention, so many other things that are provided as well. And so that work is definitely going to continue. And our patient navigators are going to continue to do the important work that they are doing, in case that there is a need for support for individuals to travel outside of the state. And I just think it's important as we have these conversations to continue to lift up the reality that abortion bans do not ban abortions for everyone. They ban abortions for people who don't have the means or the opportunity to travel. And so that's why the work of our patient navigators are so important, to break down those barriers, to ensure that people have the funds that they need to travel, or the other support that they need in order to get to their appointments.
I'm curious though, were there any legal avenues that you pursued or considering pursuing in the future? Are there any open to you or other organizations to pursue?
So one of the things that we are looking at right now is a reconsideration, and I do have Peter M on the phone right now, who
Hi,
might
yeah,
be
Ruth.
able.
Thanks so much, Ruth.
Perfect.
I'm happy to jump in. Hi, everyone. My name's Peter Eam. I'm a staff attorney at Planned Parenthood Federation of America, and I represent Planned Parenthood, the Heartland in the litigation. Now, as far as, litigation plans, I think that this doesn't foreclose future challenges, and I think we're exploring all of our options right now. As Ruth started talking about, we did file a petition for rehearing at the Iowa Supreme Court that's currently pending. But I think we really are just committed to leaving no stone unturned in this fight to ensure access, whatever that looks like.